Hello, my name is Graham, and today I want to talk to you a little bit about type 2 diabetes. You're probably watching this because you were either recently diagnosed or you've been dealing with the beast for a few years yourself. What you need to know about type 2 diabetes is that while it is a serious metabolic disorder, it's not something you need to fear. It's not something that necessarily will kill you. Nobody dies from diabetes, but you do have to give it some respect because it is a progressive disease, and if you don't control it, it will eat you up. You have a chance to become a full partner in your care and management of the disease. You can control it by losing some weight, doing some exercise, eating properly, and taking your meds. There is a number of type 2 anti-diabetic medications out there, and all of them do slightly different things. Your doctor can best advise how they can help with the program that you're running with. Your meds can control diabetes all by itself. However, that's a lot of trial and error, and there's lots of room to mess up. The more you do for yourself, the less you'll have to require medication. A lot of people say, well, my doc's happy with my numbers, so I'm happy. But you never dive in and you never ask the tough questions. You should be asking your doctor is, okay, you're happy, but could I be better? Am I doing fine? How long am I going to last? Am I still going to see complications at this current level? Because there is ways you can claw back your blood sugar levels all the way back to normal. So effectively, complications can't develop if your blood sugar is normal. Weight is always going to be your primary focus. If you're overweight to start out with, you have an 80 times more likely to develop type 2 diabetes than a person that's of normal weight. So if you were diagnosed with type 2 diabetes and you were overweight, you can be guaranteed that that was the biggest factor that caused the trigger that made you diabetic. And we're not talking about body shaming here, or body positive, or fat shaming, or healthy at any weight, which I hear a lot. You have type 2 diabetes. It's a metabolic disorder. You are not healthy at any weight. That's your body telling you that maybe carrying some extra weight's okay for 8 out of 10 people, but you're in that group where it's not okay. You were likely diagnosed after a blood test, which is called an A1C. And what an A1C does is it looks at how much sugar is stuck to your red blood cells. After you've gone to the lab and you go to see your doctor, the doctor says to you, hey, your A1C is above 6.5, and that's the clinical line for diabetes. You're a diabetic now. Well, the control target for what they consider managed diabetes is an A1C of 7.0. That really is just a starting point. An A1C of 7.0, which makes your doctor happy, all that means is that you're going to delay, not prevent, complications of diabetes for about 10 years. If you are younger, if you're in your 40s or your 50s and you're hoping to make it all the way up into your 80s, which is life expectancy, you're going to have to get better control than simply a 7.0. That is just not enough. And in fact, Diabetes Canada recommends after you get to your first target of 7.0, you shoot for a target of 6.5 and then follow on with a target of 6. If you can get your A1C below 6.0, you are unlikely to ever develop a complication because of diabetes. So you can live out just the rest of your life as a diabetic. And while you still got to watch what you eat, you're still going to have to maintain your weight, and you're still going to get some exercise. You are not going to see the nasty side of diabetes. Your diabetes team, which involves your doctor, a nurse, maybe a clinic counselor, dietitian, or nutritionist, or all of them in any combination, can help you reach that goal. You need to become a full partner in your treatment. If you ignore it, it is not going to go away. It's going to eat you up. The disease is manageable, though. You just have to decide that you're going to lace up your shoes and get with the program. Thank you.